This is the Power Producers Podcast, where we are refining and redefining the sales game.
Rule number one is you have to believe in yourself. You're the only one who doesn't think you belong in this appointment. The prospect has already validated your existence by scheduling time with you. Get it through your head you belong here, go in there, crush it, and close the deal.
A place where sales professionals can come to learn from other sales professionals and thought leaders that have mastered their craft.
The difference between a good salesperson and a best-in-class salesperson is only 2 minutes. By spending an extra 2 minutes on what you might think is a mundane task in the sales game, you separate yourselves from the pack, you grow your book of business, you close more deals, and you retain your accounts.
As well as their peers who are still striving for perfection to achieve their why.
I have a wife and 4 kids. Failure is not an option.
Real sales professionals, real stories, real results. Are you ready to feel the power?
Hey everybody, welcome to the Power Producers Podcast, where we are refining and redefining the sales game. As usual, we are bringing you the tools and technology that you need to make a difference in the marketplace today. One of the things we talk about all the time is how there's a direct correlation between workers' compensation and employee benefits. And today we have a couple of really good guests on. They're going to talk about a creative way that you can drive a wedge with your clients by using their product and not really even have to lift a finger other than to bring them in and let them do the work for you. That is what Daddy likes, is passive revenue, and you should like it too. So today from Highlight Health, we have Mr. Josh Spivak, and from Solvo. Man, short-term memory. Those 8 years of college really took their toll on me. From Solvo Health, we have Colin Kassekert. Guys, welcome. Real quick, I want to give you the opportunity to sort of give the 10,000-foot overview of who you are, what your company is, where you come from, how you fit into the picture, and then we're going to dive in and talk about practical ways that property and casualty agents and benefits producers, for that matter, that listen to the Power Producers can use your product to go out and drive a wedge in a way they may not have thought about. So Josh, let's start with you, man. Talk to me a little bit about Highlight and your background and how you fit into the mix.
Sure. For having me on your podcast, Dave. So my name is Josh Spivak. My background is I've been in the employee benefits business for 25 years, working with employers coast to coast, mid to large size groups predominantly, installing, building, and administering benefit plans. Always in my time in the business, I've always been on the, I'm going to say on the cutting edge, finding and building different and better solutions than what's in the marketplace today. And we are very excited about the Highlight Health product that we have created. And essentially what Highlight Health is a program that we have designed to serve the employee market. So think of single employees earning, or consumers earning under $50,000 a year, and families of 4 earning under $100,000 a year. We have built a very, very cool and relevant program that we've launched across the country to help those folks, help the employers with recruiting, retention, claims cost, offer something great and help employees of your, get access to affordable, relevant, quality health care. So that's essentially what we're doing with Highlight in a nutshell. We serve a variety of different verticals, but think of it as 60% of the country earns under that income level that I had shared with you. $50,000 for a single, $105,000 for a family of 4. And most of those people reside in, manufacturing, hotel, hospitality, restaurant, food service, transportation, manufacturing, and healthcare. And we are very aggressively going after those markets. And we've got a number of very quality clients across the board that will give us fantastic references, and we're looking for more. So it's an honor to be here.
Sweet. Colin, what's your story, man?
Thank you for having me, David. So I am Colin Kassekert. I am the co-founder of Solvo Health. What Solvo Health does is we look at 20 plus different cost containment solutions that exist behind a health plan. And typically what you find is when you are trying to cut or reduce costs, typically services go with that. In our instance, we're constantly looking to rewire the way healthcare is done, but also strengthening the solutions that are happening behind the scenes. Whereas in the staff and the employers don't see any difference because everything we do happens behind the scenes. We are also the GA for Highlight Health. And in my mind, when I was looking at Highlight, you look at the way of innovation and change, right? You look at the #1 taxi service in the country does not own any taxis, Uber. The #1 accommodations provider, Airbnb, owns no real estate. And in my mind, what Josh and the team have created, I think is one of the strongest healthcare solutions I've ever come across from being in the space. The need is just so great within those types of workers and within those industries, and this satisfies said need.
Yeah, I think it's interesting, man, because we're always looking for angles. We're always looking for the next best mousetrap that the other guys don't know about. And, I've been in this not quite as long as what Josh has, about 20 years on the P&C side. And, I've got experience in benefits as well. Our agency, truthfully, just when I decided what I wanted to do when I launched Florida Risk, I wanted to stay in my lane, right? I mean, it's a whole different animal to build out the back end for a benefits operation. So I have a joint venture that we have for employee benefits, traditional, but we're always having that conversation 100% of the time, because for me, if I go in and somebody's got bad workers' comp experience, one of the very first things I'm going to do when we start looking at the data is to determine how many of those claims are Monday morning claims, right? What's the lag time on claims? We want to see, #1, are people getting hurt doing something over the weekend? Are they getting hurt in beer league softball on Friday night, and all of a sudden Monday morning they have a sprained ankle before anybody gets there? Are claims taking 2 weeks on workers' comp to get reported because somebody's sort of vacillating back and forth between, should I do it, should I not do it? Because everybody that gets injured sits on the fence, and they have to pick which side of the fence they're going to fall on. And many times, it's interesting because we had Kevin Ring from the Work Comp Institute on a couple episodes back. And, one of the things he talked about was the fact that over 90% of the people that are injured on the job, it's the first time they've ever had an accident at work. They don't know what to do. And so, from the P&C side of the coin, we have to teach our employers how to have processes and procedures around educating employees about how to handle a workers' comp claim, because the very first thing they think of is, oh man, I can't afford this. My health insurance, I can't deal with the deductible or whatever else. Well, part of the reason that's the case is because the health market is tough, man. I mean, if you're trying to scale your business and go to the next level, but, #1, you have to pay a competitive wage. #2, you have to be able to give really good benefits in terms of health care. You also have to have some level of retirement. And I mean, when you start dissecting every dollar that you bring in and assign a percentage to all of this stuff, it's very, very difficult for an employer to run a profitable business, especially in the trades, man. I mean, we're dealing with a lot of plumbers, HVAC electricians, anything that's skilled labor. The issue is there's not a talent pool out there, I mean, you're not having kids go to trade schools, or maybe they are now because it's been recognized that you can actually probably make more money starting out in a trade than you can with an MBA in many cases, just because of the depleted workforce and the lack of options there. So when I heard what you were talking about, it made all the sense in the world to me, because it sounds like a much more advantageous option for an employer who's trying to recruit and retain that top talent, but also trying to, save a nickel for themselves on the bottom line. So why don't we dive in? I don't care which one of you guys, does it, but why don't we dive into the meat of sort of what the Highlight Health product is and how it works? Because to me, it makes all the sense in the world. And I just want to make sure that we drive this home, because I do think that there's an opportunity for people not to understand what the product is, and then we haven't done our job. So let's dive into it. Talk a little bit about sort of the thought process behind it, who it's for, how it works, and all of that. And I'm just going to shut up and let you guys take over for a little bit.
All right, fantastic. Thank you, David. So what I want to say is I'm going to answer your question, and we're going to get into it. But first, I want to say what the really, that's really what we're doing at the end of the day, is solving a problem. If health insurance and healthcare was affordable today, we wouldn't be having this conversation. But it's not, So essentially, the problem that we're solving is cost and access. So what happens in today? You've got an employer, an HVAC company with 30 employees, or you've got a restaurant operator with 1,000 employees, or any other industry in between. They look at the budget. They look at what does it cost to offer health insurance. They've got full-time employees, they've got part-time employees, but all those employees are important to them. And a lot of it comes down to cost and value. So if an employer if one of your clients, anyone on this group's clients had, an unlimited string of funds, they would buy the turbo best health insurance out there, and they would be able to write the check. But that's not the case. So what we have done, what we have spent years developing, is a product that answers the affordability and access question. So essentially, let's take somebody in Tampa, Florida, working in a restaurant making $38,000 a year. Do they have $300 a month to spend on health insurance even after their employer contributes $300 a month? No, some do, some don't. So our market is for those people that don't, that either short on funding, they don't have the cash flow, your clients don't have the cash flow to pay for it, or there's a number of clients that have cash flow to pay for it, to pay hefty contributions towards a health plan, but the employees don't participate because they don't see value in having a health plan that they got to pay a few $100s a month out of their paycheck for. And on top of that, they got to pay $40 when they go to a doctor, and God forbid something terrible happens and you got to go to the hospital, you got to pay $6,000 in deductibles, copays out of pocket. So that's really the foundation. So I always like to start when people ask about the problem, or ask about the product, what's the problem? So that's the problem that we solve. So what we have done with our experience and our creative.
Hey, Josh, I'm going to tell you, our audience has never heard anybody say you have to solve a problem and not sell a product. They've never heard that, like not even 1,000 times come out of my mouth. So you're preaching. Yeah, you're speaking the language that our listeners hear. So proceed, but I wanted to let you know you're on point, man, and we didn't rehearse this.
No, thank you. Yeah, we had a whole lot of rehearsal going.
Colin did.
Yeah, Josh and I were up till 6 a.m. this morning from last night.
No, but so that's what it's all about problems. So when we insert ourselves in with a broker partner and we insert ourselves in with an employer, we want to solve a problem. That's how great businesses are created. So what Highlight Health is, it's healthcare access reimagined is the tagline for what we do. So what does that mean? Look at a healthcare journey, right? And I'm just going to kind of break out the pieces. And so, I'm going to talk about different components of the plan, but know that the whole program is wrapped together through app that someone can download, and each person has access to written materials on their app and a human to call. So kind of what's missing in the healthcare world. So what is the first step in a health? Well, first, what do I do? For a lot of these underserved we're going to, people have no idea for help. I need to go to a doctor. Okay, great. You need to go to a doctor. Then you got to call a doctor. You got to get an appointment with a doctor, and you may be waiting a long time. So pre-COVID, this product was developed. So we have a big emphasis on telemedicine and virtual primary care. Attached to our program is one-touch dial, pick up your phone, download the app, you get access to a doctor with a couple clicks of a button. And it works where you have two alternatives. You can see the next available doctor, so call it urgent care. And then you also have the ability to set up a relationship and have virtual primary care. And before that doctor, so that's kind of where the healthcare journey starts. But even before someone goes to see a doctor, an advocate. So Highlight Health has an advocate that's available for you to help you navigate the system. So now we're going to start back to a doctor. you have access to prescription drugs. Now, it's a closed formulary. There's certain drugs that are available, certain drugs that are not available. But what built this product? It's got to be affordable and accessible. So for somebody to see a doctor, they can see a doctor inside of 15 minutes. Schedule a doctor with their primary care inside of 48 hours. But they've got immediate access. So a lot of these people that we're talking about, hourly workers, people that work in the trades, they don't have 3 hours to take away from the job to go see a doctor. First, so we give the power right to the phone. So obviously, the whole COVID mess has gotten people really bullish on telemedicine and virtual medicine. But we've been doing it way before that. The next step that happens, what typically happens there is that doctor prescribes a drug. Program, we have access to a great pharmacy benefit that we'll talk about, not in great detail today, but those of you that wish to engage with us and regroup, we'll get into the details. We also view mental health just as important as physical health. So we've got baseline mental health benefits built in. Baseline mental health benefits built in across the board. And again, everything is affordable when we get to the price point. So is it what you're going to buy from Blue Cross or United Healthcare that costs $2,500 a month? But we're costing, we have plans. Our most popular plan, we're selling for $125 a single. So it all comes into affordability and accessibility. So what's very important to us when we talk about this with our clients and our brokers, it's equally as important what the program is versus what it isn't, right? But there's got to be value. A lot of people don't see value in spending $2,500 for a family Blue Cross plan, but they see tremendous value in what we're doing. But that's for the buyer too. That's for the buyer to decide. We're not a right fit for everybody, but we are a right fit for enough.
Well, the thing is, some of the industries that you're targeting, based on what I know, is full of young bulletproof males who feel like nothing's ever going to happen to them, and so they don't need a doctor, and as a result, they don't go on the benefits plan that their employer offers because it's too expensive for them, and they can't justify the money because it's going to keep them from being able to go get their sixer and chips every Friday night running through the line in Publix here in Florida, right? And so, they don't view that as important. And I think that changes, obviously, when they get married and then start having kids and they have somebody nagging at them. But I do have a question quick
Sure.
to that end, because a lot of these, one of the things that everybody has to deal with when working on benefits plans is making sure that the participation rates are where they need to be, and then being able to prove credible coverage for those people who opt out of the plan. If you have a company that you're working with that has a benefits plan in place, but a large subset of employees do not carry the plan and do not have credible coverage, and they drive down that participation rate, does your product solve that problem for the employer as well? So that these people have coverage now, they can go prove that they have coverage, and it's not going to count against their employer's group health.
Absolutely. So let me answer that question with the way that we want to do, and that we'll work with you, the producers out there, and your clients, is to design a strategy that works. So our coverage can be designed as credible coverage to check the box for the penalties, and we can augment inside of a major medical plan. So I always like to, when I do this stuff and talk, I like to tell stories. But there's a group that we got in yesterday. It's a group of 6 franchisees of I don't know. It's a quick serve restaurant. So high end fast food, and there's 187 full-time employees, and they're carved out into 2 groups. There's the management employees, and then there's the hourly. So the way we're structuring that plan, there's going to be plan A. There's going to be option A for the management, and option B for the hourly. And the salaried people are going to have to pick a Blue Cross plan or United plan or Highlight Health. It's their choice. They just got to get it approved with the underwriters. So absolutely. So the long-winded answer there is, we'll work with you to determine the right way to structure. But
yeah, I just think that helps. I think that's another problem that a producer needs to know, right? Is the fact that
Absolutely.
you can actually help with getting the participation rates where they need to be.
Absolutely. So there's some, I don't want to say, I'll say creativity, but that's an overused word. There's a right and wrong way to do it, and we've got some designs and some structure make a whole lot of sense. Now we can't solve the world problem with this, but we can solve, some of the problems.
Yep.
And what I would like to do is we were going back when we talked, as you can see, the audience out there, we did not rehearse this, but we had talked about the product, and I want to go back to the product. So again, I've been doing this for 25 years. We've got a great team behind us, but so we talked about on the product side, the advocacy where you have a human to call to help you navigate the system. You got access to a doctor, you get access to prescription drugs, you have mental health because it's just as important as physical health. And what happens in the event that you need to go see in person? You need to go see an ear, nose, and throat. There's some women's health issues. There's our advocates there to help you, and depends on what kind of plan we design for with your employer clients. Either some of those costs will be paid by the underlying Highlight Health program, the insurance plan, or you'll be a cash pay customer, but we're going to ensure that you get from the right provider. So there's different options that we can build around this. And then, so there's in-person care, and then this is the magic. What happens in the event, the something gnarly happens and someone needs to go to the hospital, right? So you talk about the Monday morning claims, but if someone's out and they trip and fall going down the street and they break their leg, they get rushed off to the nearest hospital. Or it's any other type of emergency or medically necessary target. The demographic that we target that happens to be big is there are some programs at participating hospitals which enable our customers to get care, and our advocates work in tandem. The employees, the members in Highlight Health, to obtain those benefits. We look at this when I said the term healthcare access reimagined. Start to finish, a human to call to help navigate the system, access to a doc, access to drugs, access to brain health, access to in-person care, and then something really bad happens, go to a hospital and pay. So we've put all these different components together on an app in a unified way, right to the employee. It's one bill, one number to call, one throat to choke if things don't work. And it's affordable.
Cool. So, Colin, talk a little bit about your role in this whole operation.
Yep, absolutely. So, I mean, we are working directly with clients within this, partnering with brokers on the PNC side, which we're very excited to do. And it's just really helping deploy the overall strategy, right? So when you're looking at it, to Josh's points earlier, the market is wide open for this. It's 60% of the population. And then when you're looking at, brokers and majority of PEOs, they're not going after that business because the participation is so low within them, right? Because the solutions that are currently available just do not work. So as we're looking to partner with these, different brokers and referral partners to add value to their current book and also stack on some passive income, when you're looking at it from the perspective of, okay, right now they have 10, 20% participation on the plan, because again, to Josh's earlier points, right? Even if they can afford the monthly premium, they can't afford the coverage itself in the event that they need to use it. Now, what you will find is people are willing to put 90% of their paycheck towards that monthly premium that they can't afford because they're extremely high utilizers. Now, there may be a plan that's, so again, you're just jacking up your increases year over year. So from the employer perspective, right, everyone's trying to achieve the same things, right? But you have different toolboxes and resources to address those challenges. Just what's currently in place just does not work. So what we're seeing as we're going out and putting this in front of employers and bringing them on live is the need is just so great because nothing works today. And one thing that I do want to really focus on is the impact that it can have from a turnover perspective, because industries are through the roof, right? And the reason being, there's nothing to offer them currently to get them to stay, or even bring them in the door. So when you're looking at that, they say, most people are saying you can't positively impact turnover within there. I personally disagree. I think that if you actually put the right packages in place, that you'll be able to attract and retain employees.
Sorry, Colin. I have a text thread going, and I should.
I was like,
there's some laughs going on in here. We're all starting to laugh at Dave.
Yeah, I got it.
Like, man,
it's contagious, man. I'm not laughing at Colin. What he has to say is very serious. But holy, all right, I just put my phone upside down.
And if I could jump in, I would say from a Highlight Health perspective. So this is the Highlight Health relation.
Very important to us, and it's been great.
It's been a great ride. It's just getting better. So he's there to, Colin and his team are there to help shepherd, talk to employers, and get them in. It doesn't cost anybody any money. Typical, look at the typical GA models, and I'm having a tough time keeping a straight face right now. So look at the typical GA models out there. Do anything down Colin, and him and his team is our resource. And I think what's cool, Colin, is that first group we did the first client we did with Colin and his partner half a year or so ago, whatever it was.
Yeah.
But it was a hotel operator right in the middle of COVID, and I think that says it right there, Colin.
Great reference.
Yeah.
Oh yeah.
I'm thinking, what was?
Yeah.
Well, I think to your point, I think to your point about there's nothing to keep people, where they are, especially in the skilled trades, the plumbers, HVAC, that sort of thing. I mean, you get some guys that get offered another $1 per hour to go somewhere else, and they'll leave. And a lot of it sometimes they just don't really know all of the things that the company's providing for them, what that contribution even looks like and how it can impact them. So I think something like this makes a lot of sense, especially for those guys.
Yep.
Well, I mean, look, let's face it. The average guy that's working for a plumbing company or whatever, down here it's so bad. You'll have a truck from a competitor pull up onto a job site during lunch break, offer everybody a buck or two more an hour, and they'll leave and go work for that other company on the spot. And again, man, all of this stuff boils down to the exact same thing over and over again, and that is that, employees just don't get educated, right? They don't get enrolled correctly in many cases. The education piece about what they should be considering as they're looking at what plan they're going to choose or whatever else, that stuff all gets pencil whipped. And half the responsibility is the fact that you've got a marginal agent that's out there representing the carriers. But the other half of the responsibility falls on the fact that you've got business owners who don't value, like, benefits is a box they check, right? Oh, we offer benefits, but they don't buy into why they're providing benefits. And that's evident by the fact you go to have an enrollment meeting and you want to educate everybody and make sure that you're giving these employees all of the information that they need in order to make an informed decision. And you got the owner of the company sitting back there giving you the old, hey, time, we're getting close, trying to rush you through that conversation. It doesn't do any good.
Defeats the whole purpose.
Yeah. So, I mean, I don't really blame the employees in many cases. I don't think it's necessarily that they want to skip out or they don't want benefits. It's that they don't understand it and nobody's willing to give them the time to explain it to them. I do think in the spirit of education and getting your product out there, talk a little bit, Colin, about some of the things that as a PNC agent I can be listening for and our audience can be listening for, to determine, hey, this is a great opportunity for Solvo and Highlight Health to come in and do their thing.
Yep. No, that's great. I think, always starting with two main questions, right? And I think we can assume the answers to both of them. How are your healthcare costs or participation within plans? It's going to be usually terrible, extremely challenging. And how's turnover? It's going to be through the roof, right? So those are challenges that they currently have. And with the resources and things that they have currently, it just isn't going to work, right? It's, it's like, well, I want this person to I need a home run hitter, but they're 2'4", and they're not going to be able to hit home runs. It just doesn't work. No
I don't
matter
know.
how.
Jose Altuve does a pretty
true.
good job.
But as you're looking at those things, right, if you're constantly trying to add value, and I think, David, you've made some really good points just from how this can help on the PNC side, right, from experience. What we're looking to do is they want to solve these problems, but again, it just goes to what's currently available doesn't help satisfy and solve those business challenges that they have. So by putting these things in, right, attraction and retention and containing costs around what traditional insurance does, as you attract and retain, that means you're more cash flow positive, which means you can grow. So that's what we're really trying to set up from the client. From the broker PNC referral partner, I mean, to be able to go in and add additional value to the client is only going to make your relationship stronger with them. And also from a financial perspective, because we obviously want to reward for access to those clients and work within tandem.
And what I would also add to it is when you're looking at traditional health insurance markets, and again, I've been doing this stuff for years, and we do this across the country, but, you know, ask what's the first thing your client says when you show them a spreadsheet of, you know, here's where you're currently at today, here's where you're going to be tomorrow, and here's some options for you. They want to punch you in the face and throw you out the door because it's like,
Yeah, because you have like 147 different options on a spreadsheet, right? I mean, it's ridiculous. That's one reason why I could never get behind benefits as a producer is it's like, my God, you know, one minor tweak changes the premium by $5 and we have to show all of this stuff to these people or else they're not going to think, you know, we did our due diligence. Gone are the days, or very, very few and far between, I imagine. It's no different than PNC. People are accustomed to shopping on price, spreadsheeting the marketplace, and the only way as a producer that you can gain credibility is to show them you went to 100. You have here's access to 300 different plans from all these other people, and the bigger the spreadsheet, the more credibility you have. I think it's absolutely ridiculous, and it's part of the problem with salespeople out there today is they're not offering value, they're not offering education, they're simply selling on price, and they force themselves into a hole where the only thing that they can do is show all of the different price options instead of solving problems.
Exactly. And, you know, you get a spreadsheet, so then you make a tweak, and then you look at the bottom line number of how much the stuff cost, and you want to shoot somebody. So that's part of the problem. So it's got to be simplified, right? So our deal, when you look at the context of our platform, it's not for everybody, but it's for a lot. It's for a lot, and there's a lot of money to be made for everybody on this side of the table, and there's a lot of value to be given for folks on the other side. So that's what it's all about at the end of the day.
Cool. Well, listen, we can hardly get into everything that you guys do in a podcast. And one of the things we talked about is you guys are going to come on and you're going to do a 1 hour killer call with everybody in our Killing Commercial online community. So for those of you that aren't in Killing Commercial, you know, you won't have access to the private, you know, paid membership stuff that we have, but we are going to publish this in a public place so that you can hear and see the same information regarding Highlight Health and Solvo that our private community gets. So when this podcast drops, that page will have been built. You can go to killingcommercial.com/Highlight Health, and you're going to be able to have the recording of this podcast. You're going to see some comments and some marketing slicks and tips and tricks for sales from me, and you're going to have a recording of the actual call with our private community so that you can hear the questions they ask as we deep dive in other strategic ways for property and casualty agents to bring this to the forefront and hopefully drive incremental revenue in their book of business, which is the end game for all of us. So if you're not out there solving problems for your clients, probably a good time to start, because this is one that virtually everybody faces in some capacity. You just have to learn to listen more than you speak. If you ask the right questions, that'll automatically happen. And we're going to equip you to ask those questions so that you can go out and have success getting your clients integrated with this product. So, guys, I want to be respectful of your time. We got a little bit of a late start. You're always welcome to come back and we can dive deeper. But I want to go ahead and wrap this episode up. And I just appreciate you coming on and sharing the stuff that you've been able to share, and look forward to continuing this dialogue in the private community and eventually getting it out onto the landing page that everybody can take advantage of.
Likewise, David. Thank you so much for having us on. This is going to be fun, and we'll do some damage together.
Yeah, thank
Sure
you.
thing.
Really appreciate it. We're looking forward to it.
All right,
Cool.
got it.
You've been listening to the Power Producers Podcast. You can follow Killing Commercial Insurance on Facebook and YouTube. And if you want to take your game to the next level, check out our book, The Extra 2 Minutes, and our website, killingcommercial.com.